In this video, I want to talk about the health insurance plan that, on average, will save you the most amount of money. Now, it's obviously going to be highly dependent on your individual healthcare needs and the plan that your employer provides. But we can look at some of the data from different healthcare companies to get an idea of, on average, where you're going to be best off. My name is Scott Caulfield. I am a CPA and a CFA charter holder, and I'm the founder of Sophos Wealth Management. So first of all, let's just kind of define our terms. The main two plans we're going to compare are the kind of traditional PPO, that's a preferred provider organization. Now the PPO plan, you've got your in-network group of service providers, your doctors, hospitals, etc. Typically a PPO plan is going to have higher monthly premiums. So the worker component, you're going to have to pay more each month for this plan. But as a result, you usually have lower coinsurance, lower deductible, and a lower out-of-pocket max. So if you're using a lot of healthcare, this is typically the way to go. On the other hand, we have the High Deductible Health Plan, or an HDHP. A High Deductible Health Plan has obviously a higher deductible, typically a higher out-of-pocket max. However, it has a lower monthly premium. So if you're not using as much healthcare, you're typically just one wellness visit a year or something even less, this can be a great option because you're paying less each month. Additionally, the high deductible health plans allow you to contribute to an HSA. HSA almost kind of works like a IRA. So when you put money into an HSA, you get a tax benefit for doing so, or it reduces your taxable income. So these are pre-tax dollars. Any growth in the HSA, so you can put that in an investment. You don't pay taxes on the growth. And as long as you use the proceeds for qualifying healthcare expenses, you never pay taxes on that money. So great little deal there. And some employers will even contribute to the HSA for you. Another nice little bonus there. So which plan is going to be better, at least on average? First of all, let's look at what the worker contributions actually are. So we have an idea of how much do you have to pay. So in a PPO plan for single coverage, you have to pay about $1,507. For family coverage, it's $7,108. In a high deductible health plan, single coverage is $1,193. Family coverage is $5,302, so quite a bit lower, especially on the family side. With the high deductible plan, a single individual would pay $314 less in premiums, and a family would pay $1,806 less in premiums. Now, that doesn't tell the whole story. How much are the actual claims going to be? The Department of Health put out a study that showed that on average, they're using a median number here. Average healthcare expenditure in 2021, that's the most recent data I could find, was $1,907 per person. Now, with that level of spending, most people would think on average you're actually still better with the high deductible health plan. Voya Financial put out a study looking at similar data that found that 60% of participants spent $2,000 or less in healthcare expenditures. So Kiplinger did a study on that data that showed that you would save between $314 to $566 over the course of a year on your healthcare by choosing a high deductible plan. Those who are younger would save more. Those who are older would save less. And again, I suspect that just comes down to how much healthcare they're using. Because again, those who use a lot of healthcare are going to be better off with PPOs. Those who use less are going to want to go with the high deductible healthcare plan. Of course, there's a lot of individual variation on this that you got to keep in mind. That's why you really do need to do your own analysis on this. I just think it's helpful to have this starting point. But plans vary from employer to employer. So just because on average it's one way, it does not mean that'll be the case for you. There are high deductible health plans that have similar benefits to PPO plans. There are employers who contribute to an HSA for you, some who don't. Some employers require a higher employer contribution to the plans. Some require very little. So it's really going to depend on your situation and then your health situation. I mean, some people have chronic diseases. They're constantly visiting doctors and service providers with a really, really heavy cost. So obviously they're going to want a lower out-of-pocket max and those kind of things. Some people are not really using it. So you got to analyze your situation. I encourage you to visit my website. There's lots more information. And please like and subscribe to this channel. Appreciate it.